Hello, everyone, and welcome to the panel discussion on a dermat's detour to skincare during COVID times. Today's webinar is organized by Aesthetic Medicine India and powered by Orange Daily. I am Shriyal Sethumadhavan, the executive editor of Aesthetic Medicine India. And on behalf of the Aesthetic Medicine team, I would like to thank our partner, Orange Daily, all our panelists and our viewers for joining us today. Aesthetic Medicine is the original business-to-business magazine for discerning aesthetic professionals. Founded in the UK 18 years ago, the India edition is founded and led by the Professional Beauty Group. I would say it's a must-read for medical practitioners such as dermatologists, clinic managers, cosmetic dentists, aesthetic doctors, plastic surgeons, and selected aestheticians and cosmetologists. The Aesthetic Medicine Expo and Conference was introduced in India in 2019 with the aim of connecting the medical fraternity with the supply chain stakeholders and providing a platform for networking, sourcing, and training. Then came 2020, and since the world was besieged with the pandemic. We at Aesthetic Medicine continued working hard to keep the fraternity engaged. We took on the challenge and set ourselves on an exciting digital journey. In all success, the Aesthetic Medicine digital series were introduced, and our webinars and online interactions with experts have been instrumental in bringing vital information to practitioners on various aspects of dealing with the current situation or post-lockdown measures or clinic reopening strategies, as well as the treatment and procedures that are in demand. So yes, to know more about what we do and what's going to be coming up even post this webinar, you can follow us, Aesthetic Medicine India, on various platforms. We have our website, which is aestheticmed.in. You could follow us there. We have everything updated over there. Plus, you could subscribe to our YouTube channel, like us on Facebook, follow us on Instagram. You could look for us by typing Aesthetic Medicine India. In fact, this webinar also is being live streamed on our YouTube channel and Facebook page. So as I mentioned, today's webinar will focus on a dermat's detour to skincare during COVID times. Before I detail the topic and introduce you to the eminent panel that we have with us today, here is a short video from our partner, Orange Daily.
We will be bringing our Orange Daily products to your country. Our nutrition system is so complete that it will provide your skin with all the ingredients it needs to gain optimal health and thus optimal aesthetics. Once you've used our products, you're going to love them. Our retinol products and our botanicals provide the skin with all the essential elements that it needs to gain its health. You will discover the efficacy of the Orange Daily system.
Yes, so now coming to our discussion. Most skin damages come from exposure to sunlight and environmental toxins. Research also shows that blue light from electronic devices can lead to changes in skin cells. In the current scenario, how do you approach your patients? What changes could you do in your prescription, and what are the important steps to maintain skin health? What is the role that antioxidants can play orally and topically for the skin and hair? And are there any new skincare regimens for post-COVID patients? If these are your questions, then this webinar is for you. I would now like to welcome the session moderator and panelist with a brief introduction. Please welcome our session moderator, Dr. Soma Sarkar, dermatologist and aesthetic physician, Dr. Soma's Aesthetic Clinic and Academy. Dr. Soma is a well-known celebrity dermatologist with more than 10 years of experience in the field of aesthetics and clinical dermatology. She has created a niche in training budding doctors in anti-aging procedures all over the globe. Her mantra to a beautiful skin is to first maintain the skin health and hygiene. Thank you for joining us, Dr. Soma. Introducing and welcoming our panelists who will be joining Dr. Soma for this discussion. Please welcome Dr. Narmada Matang, dermatologist, Neoskin Aesthetics. With over 20 years in practice, Dr. Narmada has been involved in training fellow colleagues for aesthetic procedures. She is a certified international trainer in minimally invasive techniques for aesthetics. She has also been educating clients through online publication, and her book, How to Look Like a Million Bucks, along with a few other medical books. Dr. Pragnya Manvatkar, Head of Cosmetic Dermatology and Emodermatology, Skin Mantra Clinic. Dr. Pragnya started her private practice in 2009 and provides a variety of non-invasive treatments. She believes that a lot of skin issues need active counseling and has hosted multiple sessions on psychosomatic issues for her patients in collaboration with psychologists in her clinic. She is set to publish her first book, a self-help book, How to Tell Your Skin to Heal Itself, by the end of July 2021. Dr. Rickson Pereira, consultant dermatologist and head Dr. Rickson's Dermatherapie Clinic and consultant dermatologist, Holy Family Hospital in Mumbai. Dr. Rickson Pereira is a certified dermatologist with 11 years of experience in private practice. He has experience in treating skin, hair, and nail conditions, leprosy, and sexually transmitted infections. He also has 10 years of experience in aesthetic medicine, including lasers, botulinum toxin, fillers, peels, radiofrequency, and other energy-based devices. He has worked with several leading filler and botulinum toxin brands. And Dr. Rupali Pavaskar, dermatologist, cosmetic dermatologist, and trichologist, Dr. Rupali Pavaskar's clinic and Transforme Dermo-Cosmetic Center. Dr. Rupali Pavaskar has been practicing for over 17 years. She is a member of various associations, including IADBL, CDSI, Association of Cutaneous Surgeons in India, and European Academy of Dermatology and Venerology. She has conducted various lectures and workshops at national and regional conferences and has taught students in her clinic as well. She has won the BB Gokhale Gold Medal at national level for best presentation too. I would like to thank all our panelists for joining us today. I now request Dr. Soma to take the discussion further. We have 45 minutes for the discussion. We would like to follow it with a round of Q&A with all our attendees and viewers. So for my attendees, at the bottom of your screen, you would have a chat box. For those on YouTube and Facebook, you would see a comment section. For those with us on Zoom, you would see a Q&A box and a chat box. My request would be for you to key in your questions into the Q&A box, and we would be happy to take them up at the end of the discussion. Over to you, Dr. Soma. We look forward to an engaging discussion.
Yeah. Hello, everybody. Good evening to all the panelists. They are the esteemed panelists. I'm very proud and honored to be amongst them. Thank you, Shriyal, for such a lovely, humble introduction. I'm also thanking the Aesthetic Medicine and Orange Daily to give us this opportunity to discuss the practical tips of the skincare in this COVID times. Before we start discussing, let's talk about something as in we all are into practical practicing as in our skin and hair care routine. And I'm sure that everybody since last 2 years, the whole medium of our practice have changed. You know, we were regularly going to the consulting rooms and suddenly we had to sit at home and do online consultation. We had our limitations to examinations. We had our limitations to medications. Everything would have to be online. So today here we are going to try to understand how we have evolved through this journey. What are the changes all the doctors have made in their practice? Have they found out any key medicine or any key creams or oral antioxidants which has helped their patients in their practice, and probably like to add on to our armamentarium as well. So I would like to start my question with Dr. Narmada. Dr. Narmada, tell me something that during this COVID period, did you see anything in particular, like any changes in the complaints of skin and hair, as in vis-a-vis they have suffered from COVID, not suffered from COVID, but something which is what typically not very same as it used to be?
So good evening, everyone, and thank you, Aesthetic Medicine, for giving us this opportunity. So Soma, coming to you, yes, you know, the entire practice, the way we would look at patients is definitely changed, I think. And what I feel is these online consults, sometimes, you know, your the anxiousness that you see in patients. And so there were these patients who had suffered COVID. Big time, I think, sitting in my clinic now, also what we are handling is post-COVID hair fall. It's intense. It's, you know, psyching the patients out. So definitely that is a big chunk of change that we are seeing. And, you know, the thing is that a lot of counseling needs to go now. Earlier you would say you would educate the patient and you would start the therapy, but here it's a long drawn process. You have to keep counseling, almost every session. So that definitely is something that I'm seeing. The other thing is, so these are the patients who suffered COVID. So hair fall is big time. The others were patients in my practice who were hospitalized. So their skin had really changed. There were patients who were intubated, and they had pigmentation and skin erosions around the mouth. There were skin changes on the palms and the hands and the feet that you could see after recovery as well. Pigmentation is a big issue. I think when they put up on multiple drugs while the treatment was going on, is pigmentary changes in the skin that we saw. And of course, these were COVID patients who suffered COVID. Then there were patients who not suffered, but I think post-vaccination urticaria is something, and it took another level of paranoia in patients, because some of them had earlier history of urticaria, but a lot of them did not. So they were really psyched out and running to the hospital after online consults also. So those are the things. Then regular, I think during the entire pandemic, the level of use of sanitizers went up, and there were a lot of dryness issues, especially in the hands. And I think we had done a session on that as well. The importance of moisturizers, choosing your sanitizers, sensitive skin, how do you choose your sanitizers? We did an extended session on educating patients on that. And I think lower face acne, continuously being in masks and the sweat, people who are, either working at home all the time, not really able to take care of skin. So there were a sect of people who just didn't have the time because there was so much to do and no help. And then there were patients who had all the time and overdid. They educated themselves on the internet a whole lot and ended up, excessively exfoliating, and hence getting into skin rashes and acne and other issues with the products that they were using. So I can't hear you.
Dr. Soma, you need to unmute.
Yeah. Thank you, Dr. Narvida. Now, Dr. Rupali, tell me something that obviously now I'm sure that you all guys have got very pro in your online consultations and examinations. But Dr. Rupali, would you just throw up a light at how difficult it was when we started initially? Was it very difficult because we couldn't examine the patient, physically? And was it giving a lot of apprehensions to the patients? And was it a challenge to you itself? Were you happy, satisfied by giving online consultation? And would you think that that was helping also to a bit for the patients?
Dr. Rupali, you need to unmute.
Sorry. So first of all, thank you, Ms. Shreyal and Aesthetic Medicine for giving me this opportunity. And that's a very interesting question, Dr. Soma. Actually, speaking, we were not working for the first 3 months of the pandemic. And so in a way, we knew at the back of our heads that there are patients who are in need of us. Fungal infections are on a boom, were on a boom at that time too. And I really wondered what these patients must have done to themselves, self-treating and whatnot. So it was a relief sort of when this online consultation thing started. And it was also a good thing for us to remain occupied with something rather than just maybe study or work at home or whatever. So initially, yes, patients were a bit apprehensive. Many knew that online consultations are available, but most of them didn't. As far as we are concerned, luckily for us, as compared to any other specialty, we have something called a spot diagnosis. So most of the photographs were good enough for us to diagnose easily. But then asking the patients to send good quality photographs was a task. Trying to identify the exact skin disease when it comes to closer diagnostic evaluations, that was a bit of a challenge. And for me, like I used to write down my prescriptions initially and then sudden shift to online consultation. Luckily, I have a good typing speed, so that really helped. But all these challenges, like you said, have now been successfully overcome. And yes, now we don't, luckily, we don't need much time, so it happens more quickly as compared to physical consultations. But I would also like to add on one thing to what Dr. Narmada has elaborately detailed, that acanthosis nigricans and PCOS has been on a rise because of high carbohydrate consumption and total lack of physical activity. So, as treating physicians, we all should watch out for those kind of pigmentary lines on the nose, the back of the neck, and dull skin and acne, jawline
Absolutely.
acne.
Yeah, absolutely right, Dr. Rupali, because I was just going to add on that
Okay.
apart from this, because everybody was in the house, the initial phase of COVID, where people really did not know what to do, we had a lot of weird sleeping hours. We had a lot of binging happening, a lot of Netflix series going on and on and on because there was nothing else, obviously, apart from your home work to do. But then this was something which I also came across. A lot of patients had a lot of dark circles, started having dark circles, started having a lot of premature aging signs gradually after a certain period of time. Coming to Dr. Rickson now, because Rickson is very much into procedures. His patients opt for a lot of procedures with him, and I wanted to know that how did he manage, because procedures are something which cannot be done online, and how was he stalling the patient, or how was he coping up with this kind of patients? How was did he introduce something, did he change any home care routine for these patients so as to stall them till they come physically into the clinic?
So, thank you, Aesthetic Medicine, for having me, and it's wonderful to join everyone on a Sunday evening. So, the initial, I think, the first 3 months, I think till June last year, I had to stop all procedures, and we were keeping up with the government guidelines, and I was only doing online consultation till then. And of course, we used to see some patients in the clinic, but I think when I was doing some emergency procedures like cauteries and all for, or some abscess or a cyst, with masking and protection and all of that. From June onwards, we started doing a little by a little, we started getting, because before that, it was difficult for the staff to travel. There was no, there wasn't much protective equipment available. But from June or July onwards, we started getting some PPE gowns and masks, and we started doing, lasers and laser hair removal and all slowly one after the other. Of course, the initial footfall of patients was much lesser because everyone's apprehensive of doing procedures in the clinic, and we used to have hair removal patients who were asking what will happen if we do. So we used to tell them just shave for now, and whenever you feel comfortable, because obviously it's a risk for anyone to actually turn up to the clinic. So we used to say you manage it. We used to give them tips for managing at home. I would tell people just shave, and whenever you feel safe to head out, you can probably drop by. And as far as treatments are concerned, we weren't doing, we were doing treatments on the body so that patient could wear a mask when the procedure was going on. And gradually, I started taking patients in for initially for Botox because they could keep their mask on, and later fillers. And as far as treatments were concerned, I used to do things like, instead of doing maybe a glycolic peel every 2 weeks, I used to tell patients do a yellow peel every 2 or 3 months, or quick procedures like we stopped doing facials completely because it sometimes it takes up to an hour. So we used to do only quick procedures like a peel or a yellow peel where you just apply, and the results tend to last. And of course, I used to give home care regimens for 2 to 3 months so that they could sort of reduce the number of times they would come to the clinic. So so I think I was giving longer prescriptions, reducing the number of procedures, increasing the interval between procedures, preferring procedures where a patient could wear a mask, and overall minimizing the number of times that the patient would have to come to the clinic. But eventually, all that's changed now. Everyone's vaccinated. Everyone's and now, I mean, I used to do online consultations, but recently the in-clinic patient load has increased so much that I have to actually stop it because there's no time. So yeah,
Any of
things are
your
slowly
patients,
coming back to normal, I would say.
But Dr. Rickson, any of your patients particularly asked you for a particular creams or anything orally? Specifically, patients were taking injectables because they were not being able to do for a certain period of time. Were they keen in doing something more on prescription?
Not really, because the thing is, I'll be frank. Like what an injectable can do, only an injectable can do. No cream or this can replace it. So it's an understanding between the doctor and the patient that there is a risk involved in the procedure, and if they're willing to take that risk, if both parties are mutually consenting, you go ahead with the procedure. Nobody blames anyone. I mean, it's a pandemic. It's an airborne virus. Who are you going to blame? And you can't blame anyone as the source of infection. If you're unfortunate, you get it, and you take all the precautions that you need, and you hope for the best. But you cannot really, if a patient comes to me for a procedure, they cannot really tell me that it's because of you I got it, because we used to always make it a disclaimer. You come if you feel comfortable. Okay, I'm going to wear a mask. You'll be wearing a mask. Around me, I will try and minimize the number of people that are in the room, especially with injectables like Botox and all. I didn't have the staff standing behind me, which I usually do. It used to just be me and the patient in the room. That's how it is. Yeah.
Thank you, Dr. Rickson. Now to Dr. Pradnya here. So, Dr. Pradnya, can you put us a light on when you were looking at your patients online? I'm sure, as I said, that there were a lot of anxiety in the patients that they are not being able to see their doctors physically, especially patients who were suffering from acne or probably suffering from melasma or any pigmentary changes, and they would suddenly feel lost because they can't physically go to the doctor, touch and show them that what was bothering them. Do you think it was only the pathological cause that time, or also that mentally also it was adding to the aggravation of these disorders? What do you think? Because you deal a lot of mental associated skin symptoms as well.
Oh, yeah. So I have two answers to this. One is that I had a set of patients who are very happily doing a video consulting. They were like, "Kahin jaane ki zarurat nahi hai. I'm at home. I'm just going to, book an appointment, pay the money, and I don't have to move anywhere." And that was to a large extent creating issues, because to observe the changes in pigmentation or acne, or even something as something like eczema on a video when it pixelates, I'm sure that all of us who do video consulting, you understand that, okay, it's very difficult. So I had that set of patients who were very happy with the situation, and I had those set of patients who were like, we won't come only, we don't want a video consulting, but we want you to see. But honestly, that number, those group of patients are very few. I think now what's happening is everyone is shifting to video consulting. So there was no apprehension or fear per se of people wanting to show on video consulting. They were actually very happy that we are not getting exposed to the virus. We don't have to wait anywhere, travel anywhere, and it's easy. The only problem that I did face was with the elderly. And I have quite a subset of elderly patients. So unfortunately, unka wo, because they're not very technologically savvy, it was getting very difficult to treat. And there were so many cellulitis patients in that first 2 weeks of the pandemic. I was shocked, and I will associate that with the increase in the stress levels. There is absolutely no other reason why there should be a surge of phone calls or cellulitis everywhere. So that is another thing that I saw, that the elderly were finding it difficult, especially in this pandemic, to come and show, and treat themselves. But in terms
course of any treatment with them, as in, did you take obviously a detour? That's what we are talking about, apart from your prescription drugs.
Into cellulitis patients?
No, in general, I'm talking about.
So a detour in terms of so my VCs increased, right? And I kind of set a protocol. So my protocol is very simple. You have to send me photographs first, right? Without photographs, I'm not going to, get onto the video chat. That was what I, kind of made it a mandatory thing for a video call. And they had to be of certain specifications. So I used to send them actual, close up kaise nikalna hai, how to take a mid shot and a far length, and then send me the photographs. That has really helped. And giving that perspective to the patient helps the patient understand that, okay, this is being taken seriously. Because then they used to send random photographs from somewhere, from standing against the light, yahan pe shadow aa raha hai and yahi pe mark hai. So I think this has helped me get better with my technology and my communication, electronic communication that I am actually, doing with my patients. So yeah, that is a detour that I took. Otherwise, in terms of oral antibiotics is something that I refrain from, honestly, because I still find it uncomfortable prescribing long-term antibiotics or medicines like isotretinoin or acitretin on or methotrexate on video consulting. For them, I insist that they come and see me once, and then subsequently you probably can take over video consulting. But yeah.
Thank you, Dr. Pratya. So now, Dr. Narmada, can you please enlighten us that have you specifically pick up anything in your skincare routine for your patients?
Soma, I would say, people were home and they were bombarded with a lot of information. And some of them really went overboard. And interestingly, because we had this session, I came across one study, which was, of course, not an Indian study, but they really had done this questionnaire kind of understanding. And it pretty much reflected my experience as well, that there was this sect of patients who went overboard with the information available on internet. And there were these patients who were not bothered at all. So they now are coming back and I did not do anything in the last 1 year. Now you tell me where to start. So I think how I handle this would be, realigning and educating them in terms of, and then there were a lot of things not available because of the logistics and all of that. So obviously, yes, we had to, include a lot of home care right there in the kitchen. The scrubs, in terms of, you started educating them that, you could use almonds at home and a lot of other things that were available right at home. They could do it, but controlling them in terms of not overdoing it, because the skin was definitely becoming sensitive and, they like the first look and then they just overdo it because they feel that this is what is working for them. So yeah, that got introduced in terms of understanding how they are, dealing with the routine.
Did we, okay, I would like to ask Dr. Rickson, because what has happened is we were loaded with a lot of immunity boosters concept, in this period, that everybody was talking of immunity boosters in some form, have zinc, have oral antioxidants, and we should have this. So we also had a lot of clinics propagating a lot of IV infusions, immunity booster IV infusions. We had a lot of new molecules now coming into the market because of this immunity stuff, and I would really want to practically know from Dr. Rickson that, Dr. Rickson, how much did you, inculcate these antioxidants in your practice? Did you think that they really made a difference? Or do you think that apart from orally, topical creams also play an important role when it comes to antioxidant? There are certain agents, particularly, which we use.
So, as I think, like what Dr. Narmada said, there was such an information overload. People were already self-medicating, and there's this whole thing about kadhas and how. But the thing is that spices are a very common cause for aggravation of dermatitis, rosacea, and acne. So a lot of breakouts happened after kadha consumption. I personally believe the only thing that can improve your immunity towards COVID specifically is a vaccine. Okay, so that's how it is. I already had so many patients who were popping zinc left, right, and center, throwing up because of it, and pretty much having all the vitamins worsening their acne. And there was an overdrive of self-medication. Okay, so I had to actually wean patients off and tell them give it a break. Okay, stop the zinc, because I know patients who have been taking zinc for 8 to 9 months and actually ends up with iron deficiency. They were popping biotin left, right, and center. So that because they didn't have apparently they couldn't come to a doctor when it could have been easily done through a video consultation. But that's another thing. But the thing is that there was actually a lot of people who were actually popping things. And as far as change in my supplements, I think I've started giving N-acetyl cysteine and glutathione a lot more than I used to, because it does have an anti-inflammatory effect in the lungs. So post-COVID, I do give a lot of N-acetyl cysteine and glutathione. And so, after this COVID, we see that the skin becomes really dull and just doesn't respond to anything. So I always tell patients, give a 3-month break, let your body because COVID is like such an assault on the body that, the nutrition to the skin and hair completely cuts off. So I always tell people, just rest it out, let your body, even if you're not getting results to any treatment, it's okay, because it is going to take time. Okay. And typically I've seen people take at least 3 or 4 months to sort of get out of that COVID look. Okay. And before the hair fall starts to reduce, the skin begins to recover. So I think out of all the antioxidants that I routinely prescribe, I think maybe I've increased the use of glutathione, N-acetylcysteine, and probably tetrahydrocurcumin. But in terms of course, people were already taking, like in the area that I practice, and even Dr. Soma and Dr. This Pradnya, because we in Khar, Bandra, Mahim, everybody's already ahead of things, and they've already popped everything before they've come to us. Okay, so we need to wean people off, tell them just slow it down, maybe don't take it less often, or rotate onto a different set of nutrients which they haven't been taking, because sometimes you overdo one nutrient and you create a deficiency of the other. So you need to sort of align them in that and guide them in the right direction. So I think I think we here in this side of town deal with the self-medication and over doing everything, and we need to ask people, slow down. You're just overdoing it, and that's also causing harm.
I can take the liberty and ask Dr. Rickson, because Dr. Rickson suffered COVID by himself. Okay, and Dr. Rickson, can you tell us that did you yourself see, because I remember you having little acne on your face and a hair fall issue. So did you see any changes in particular post-COVID, your recovery?
I think post-COVID, it worked very well for my weight control, because I just lost a lot of weight. And other than that, I think I got a lot of hair fall. I mean, starting on the 2nd and 3rd month, I literally like lost half my hair. And the skin became really dull, and nothing seems to work, because I keep rotating between things, topical retinoids, AHAs, niacinamide, and stuff. So nothing seemed to be working, because your skin just continues to get duller and duller and duller. And even even sunscreens and all don't, I mean, you feel your skin is progressively darkening and getting duller and becoming very uneven. Also, it becomes sensitive. You can't probably use the same set of prescription medicines or the same strengths that you could, because your skin is just. I'm sure that when you go through something like that, it affects the barrier function of your skin. So the tolerance of the skin also comes down. So not only is it not giving results, but it's also getting irritated by whatever you subject it to. So I would say that post-COVID, it's very important to focus a little bit on barrier control, barrier repair also. Just be like moisturize, use gentle cleansers, don't exfoliate too much, and give your skin time. It takes time. I mean, because you're also mentally because a lot of, fortunately I didn't develop any fatigue, but a lot of people do get fatigued. It's a very common complaint. Like a lot of people have mild COVID, but the fatigue is just something they've never experienced. So and in that whole thing, that you're mentally also, you're down, plus your skin and hair, all of it looks, and it's very important to like I went through it, but I could tell people that this is something that happens after COVID. Take some time off. It's okay, your body will recover. It does take about 3 or 4 months, I would say, for your body to actually feel better after COVID. Yeah.
So thank you, Dr. Rickson. I have also positively realized that my patients who were not asking for any kind of antioxidants, obviously I did see an increase in that, and people started asking for more of glutathione, actually, oral glutathione and vitamin C. Nevertheless, Dr. Pratya, can you just throw me, I want you to tell me how would you go if I have a patient coming to you who have suffered from COVID and comes to you and says, doctor, please help me out in terms of a prescription, and give me a AM care or PM care, tell me the diet and the nutrition, tell me what lifestyle changes I have to do. So you have to divide these answers in 3 parts and tell me in specific, short, but explain it to me. How would you, for the audience, how would you do that?
So this is just post-COVID skin and hair care, am I right?
Yeah.
I guess, like, I mean, adding to what Dr. Rickson has said, that there are a lot of nutritional deficiencies, and it's a big attack on your skin and the hair. I mean, all of us have experienced post-COVID hair fall in tremendous amounts. I mean, people actually bring bags of hair, and that's like a routine thing for all of us. So I feel that more than just overdosing the patient with oral vitamins and minerals, my basic go-to in terms of taking care post COVID is lifestyle, immediate lifestyle modification. Because I'm telling you, all the people who've come to me have blamed COVID for their for their faulty lifestyles, and I tell them it's not COVID, it's you. I mean, you had every time and the whole time in the world to actually set a timetable. So I think sleeping by 10, because the body starts shutting down, because the pineal gland senses the melatonin, senses the sunlight go down, the melatonin starts increasing. Therefore your systems are shutting down by 8 o'clock. So at the most by 10 you go to sleep, you get up at 6, you get up at 5, whatever. It's not how much you sleep, it's when you sleep. That is the one advice I give everyone, because everyone is in this glorious mythical world where, oh, but I get my 8 hours of sleep. So I kind of refute that. That is the first thing. Secondly, eating and how to eat. And I have so many patients telling me, but I eat ghar ka khana, I eat ghar ka food, because अब COVID में बाहर का नहीं मिल रहा है. I said, but if you're going to eat a dal chawal at 12 in the night, if you're going to have a fruit like some absurd hour, you're not going to get the benefits, because you're this is the so in very short, how do I sum it up for the patient is, you are not your body. And then they all look at me stumped, and I then ask them, who is breathing for you, who is beating your heart for you? Do you have an on off button for your menstrual cycles? Do you have an on off button for your digestion? You don't, right? You're making your own poop, you're getting hungry without your knowledge, which means your body is in a particular system and you are actually not helping it. So lifestyle modification, one. In terms of care, depending on what the patient has come up with, if it's acne, you give routine acne care. If it's dry skin care. Atopics, itching has gone up severely. Atopic dermatitis, because of the stress, itch has gone up. So coconut oil is my go-to product, because I feel it's very easy available, and it's just gives marvelous results, because the composition of the coconut oil is very similar to the natural moisturizing factor. So it kind of goes and fits like a lock and key. So I suggest that. And in terms of what was the last question? What was the third? Divided into three: skincare, lifestyle, and yeah.
Skincare. Yeah. So more or less you've answered my question. Now coming to Dr. Rupali. Dr. Rupali, tell me something that obviously now we have passed the COVID phase and we had the vaccination phase. Initially, people were really bothered that should we take the vaccination. I had my psoriasis patient calling me up and asking me, should I stop the medication for psoriasis and then take the vaccination, or how the gap has to be, because I had not taken some viral disease. Some patients who were on isotretinoin, they did come and ask me, will my IPS flare up if I take the vaccination? Should I have to take a gap? So did you face some these kind of things? And if the patient was also vaccinated, after that also did they have these kind of queries?
No, like you said, they would I mean, they would just call up and ask, "Hey, I am on these medications given by you, so can we take vaccinations, or do I have to stop the medicine?" These were the questions. But post vaccination, not really that, whether it would flare up my existing conditions. However, post vaccination, there have been many skin complaints coming up, like urticaria, like Dr. Namada said, and also unusual kind of pigmentation, something like fine bleeding into the skin, that also has been my observation, or various other erythema nodosum and all these kind of things which were commonly seen. Even herpes zoster, I mean, that herpes zoster thing haunted us right from the first lockdown, and it is still there post vaccination or post COVID infection, even without that, where I think stress has a major role to play. So awareness, as practicing physicians, awareness about the vaccine, its effect, and also whether with certain medicines we should take or not is very crucial. Now, as we all know, mostly even immunosuppressants, maybe they need to be lowered. I mean, the dose has to be lowered a bit, but otherwise, by and large, most of the medicines are okay with vaccination, and they can be freely taken. So otherwise, post vaccination, no concerns about skin as such. But yeah, all these things, the medical conditions are on a rise post vaccination, definitely.
Yeah, I'm so as in I can sum it up here saying by this question that okay, we all had different phases of this COVID with us. the vaccination, during the vaccination, and all those kind of things. And I think we all have now got, pretty much aware and things how to take our skincare routine with our patients. Coming to Dr. Narmada, Dr. Narmada, could you tell me what is your favorite antioxidant? Like normally we like to give to your patients, and you see that they give you really good results.
Soma, I can't hear you clearly. I'm
Yeah,
sorry.
you're not very clear.
Dr. Narmada, can you
Yes.
mention to me one of your favorite antioxidants which you normally like to give your patients when you really feel that they make a difference?
Vitamin C.
Okay. A little bit of information about the vitamin C.
So vitamin C, both orally and locally, has worked wonders. It's a simple thing, and I think over the years, it's convinced a lot of my patients. It is now so. If you really get into the working of all the antioxidants, it's always a combination. It's not one single thing by itself. So moment they are in combination, it could be anything. It could be C with E with idibinone, or various other peptides along with it. It could be with HUA and moisturizers of the level. But my favorite, and I'm sure a lot of us relate in that sense, is the C. I just wanted to add to the earlier discussion that you were having, the vaccination bit. Interestingly, a lot of my patients were hesitating for toxin post-vaccination, and they were willing to wait. They were okay with the fillers, but they were not okay with the toxin. So just wanted to mention that. Coming, Hannah? Yeah. I think a lot of other webinars.
Definitely, yes. Yes.
Yeah, so other webinars also we were attending, and it was across global, kind of a phenomena, that patients were okay with the dermal fillers, but they were very hesitant and, wanting more information on the toxin bit. So that was something that I experienced in the practice as well. And I think off late, very recently, patients are open and coming back for the toxin. But fillers, they were pretty okay with. Antioxidants, various combinations are something that pretty much goes now, even in my younger patients, so that they get used to it. And dare I say that, sometimes in my prescription, it's only the oral and a combination of antioxidants that has worked even for, PIH, various traumatic PIH and all of that. It's just done wonders. But idibinone is another one that is really my favorite as anti-aging. It's of course on the expensive side and not very commonly available in creams and serums. But that's another one that's really my favorite since yours.
Can I add something here, Dr. Soma?
Yes.
A combination of vitamin C with polypodium leukotomas was my favorite. Actually, it used to it used to give me wonderful results, but unfortunately that molecule has been taken off the shelf. So of lately I've been combining astaxanthin with vitamin C, and not even that is okay. I mean, good as a combination. But most importantly, collagen is something is coming up like anything. Even those patients who are not able to control their hair fall with our regular hair vitamin supplements, they are showing wonderful results with collagen supplements. So collagen has become suddenly my hot favorite.
Okay, so I would ask the same thing to the other two panelists, Dr. Rickson and Dr. Pratnya. A little take on your oral antioxidants, what you like to give it, something new, what you find out during this period. Does really oral collagen, I just want to know for myself also that how much does oral collagen or oral nutraceuticals work in the practice? So Dr. Rickson, you can start and then you can take, Dr. Pratnya can take the question.
So as far as results are concerned, I always never attribute say a result to a certain thing. It always has to be a combination of multiple things, okay, including people's lifestyles also, because I realize that I spend so much time telling people to correct the way they eat, their lifestyle, and how to manage products. So that a lot of that has to go into it. As far as specific sort of efficacies are concerned, I like N-acetylcysteine a lot. I like Silimarin a lot because ever since, I mean, polypodium used to be one of my favorite molecules till it got banned. And I don't know for what reason, but I think since then I've started. I used to use Silymarin before. I used to use polypodium. I've come back to that. Also, niacinamide is something that I like, both in topical and oral form. Alpha lipoic acid is another thing, which I really like. I see that a good dose of alpha lipoic acid always brightens up the skin. And yeah, as far as collagen supplements are concerned, I just feel collagen supplements, the results are not because of the collagen in it. I feel the results are mainly because of the antioxidants in it. So because I mean, if you eat a piece of fish or chicken, you'll get the same amount of collagen that you have. So I personally believe that it's not the collagen, but the other antioxidants that make up the formulation. Because a lot of collagen supplements have good antioxidants, like some have arginine and glucosamine and sodium hyaluronate and of course vitamin C. So it's the overall combination that actually decides uh, the 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 decision to prescribe it depends on the overall formulation rather than the collagen itself. And of course, if you want to give collagen, you have to give it in a sufficient quantity, because ultimately it's doing the role of a protein. So you need it at least in 5 to 10 grams a day. So I definitely don't think collagen tablets do the job, because the dose is just much lesser. But I would prefer giving a collagen powder that you can take in a sufficient quantity, and it varies from person to person based on their lifestyle. If they eat non-veg very less often, or they are vegetarians, and or they eat non-veg much less often, then I try to give them more regularly. And the ones who already eat non-veg, I give the collagen supplement mainly for its antioxidant benefits, and you can give it less often, maybe 3 or 4 days in a week. So yeah, so this is what.
What about Dr. Pradnya? We have to sum it up now because we have started getting a full flow of questions here for us.
Yes. So for me, it's vitamin C, my favorite. I love giving vitamin C. I think it just helps in collagen and it boosts the collagen formation. In terms of collagen, I don't give collagen supplements. I don't know how they work, and therefore, for me, I stay away from them. There's so many brands, and without studies and researches, I kind of stay away from them. I'm sure that if I mean, Dr. Pavaskar, when she says she's getting results, I'm looking forward to knowing, later how she gives it. So yes, that's that. And in terms of the only thing I want to continuously stress is that I am someone who wouldn't like to give a barrage in a host of medicines. I emphasize on lifestyle, because then we are very linear people. We want 2 plus 2 is equal to 4, and I kind of tell them, you can take this, you can take vitamin C. I like vitamin A, although it's not an antioxidant, but it just helps. Vitamin A and vitamin C, my routine prescriptions, and zinc, depending on how the patient has been taking it. And I tell them, lifestyle modification there is no absolute solution, and you have to turn over that responsibility to the patient at some point. Otherwise they start getting dependent on these medicines, and at some point I'm like, okay, no, I'm not just going to give you an antioxidant because you're not going to take care of yourself. So honestly speaking, I don't play around much. I just use these three. Yeah.
Thank you, all the panelists.
Thank you, Dr. Soma, for leading this discussion so gracefully. And thank you, Dr. Rickson, Dr. Pali, Dr. Pradnya, and Dr. Narmada for all those insights and inputs that have been shared, and also for patiently going through that Q&A. This brings us to the end of today's webinar on a dermat's detour to skincare during COVID times. The webinar was organized by Aesthetic Medicine India and powered by Orange Daily. I would once again like to thank all our panelists for being a part of this webinar and sharing such great insights. It was indeed a great pleasure hearing from each and every one of you. Our partner Orange Daily, thank you for all the support. I would also like to thank the viewers for your support, presence, and being so active in that Q&A box out there. Kudos to our dedicated team for putting this event together. And as we come to the end of this evening, here's looking forward to a positive and safe times ahead for all of us. Thank you once again, and have a lovely evening, everyone.
Thank you, Shreyal, and
Thank you.
Thank you so much.
Thank you so
for having
much.
me.
Thank you. Thank you.